So let's study Kanda Bhagna in a simplified form with quick mnemonics and notes you will never forget. In Ayurveda, Bhagna refer to both Asti Bhagna and Sandhi Mukta. So we usually say Asti Bhagna or Sandhi Mukta, both refer to Bhagna. And let's study Kanda Bhagna Nidhana in simplified manner. So we can say in mnemonics, that is a Papa asked Prakash why Abhi. So Papa, Padhana and Pidana, asked Akshepana, Prahara is Prakasha. And why? Vyala, Mriga, Dashana, Prabhidibhihi. And Abhi means Abhighata, Visheshe. Papa asked Prakasha why Abhi. So let's see each one. Padana. Padana means it is a fall. So fracture due to a dislocation due to a fall comes under Padana. Pidana. When there is a compression or the squeezing of the body, it may result in a dislocation or the fracture. We call it as a Pidana, Nidhana. Akshepana. When there is a violent jerking or pulling. Prahara. When there is an attack or blow. Vyala Mriga Dashana. When there is an attack or bites of the ferocious beast. Abhikada, other type of assault or injury. Types of Bhagna. So Susruta mentioned two type of Bhagna. That is Sandhi Mukta Bhagna as well as Kanda Bhagna. Sandhi Mukta means it is a dislocation. Susruta mentioned 6 type and Kanda Bhagna is a fracture, 12 type. Vagbada, Sandhi Bhagna and Asandhi Bhagna. Sandhi Bhagna means which affecting the joint. Not affecting the joint, we can say it is Asandhi Bhagna. Madhukosha Tika Khara. Savrana Bhagna, that is the open fracture. Avrana Bhagna, closed fracture. Sandhi Mukta Veda. So I told Susrita mentioned 6 type of Sandhi Mukta, that is a joint dislocation. We can say, we can study using the symbol mnemonics, that is Usha's very vibrant art thrills out. So Usha, Utpishta, very, Vislishta, vibrant, Vivartitha, Avakshipta art, thrills, Tiryakshipta and Adikshipta all. Okay, so we can study, decode each of them. Utpishta means fracture dislocation. So we can see there is a dislocation. Subluxation of the partial dislocation is the Vislishta. Dislocation with the lateral displacement. So we can see the joint have moved laterally. Then it is Vivartita. With downward displacement, Avakshipta. Adikshipta means there is an overriding. Tiryakshipta means dislocation with the oblique displacement. And Sandhi Mukta Veda by Sharkandara is 8 type. Bhagna Prishta, Vidharita, Vivartida, Vislishta, and Adhogada, Urdhvagada, Sandhi Bhakta, Tiryaka Kshipada. Now Sandhi Mukta Lakshana. Incapability of Ashakti of doing Prasarana, extension. So the person is not able to extend or Ahunjana, flex. Vivartana, rotation. Akshepan, quick movement. And also Ugra Rijutam, if the person is feeling extremely painful or Sparsha Asahotva, inability to tolerate the touch, we can say there is some type of joint dislocation. And Vishesha Lakshana, Utpishta means Sandha Ubayadaha Shobho, Vedana Pradurbhovo. So there is swelling as well as pain appear on both sides of the joint. Visheshadashcha nana praghara vedana ratro pradhurbhavanti, with different kinds of pain at night. And Vislishta, that is a subluxation of the partial dislocation, there will be alpashobha, slight swelling, accompanied with vedana satyatva. Vedana sa atyayam. So atyaya vedana means there is a constant pain. Sandhi vikriya, not able to function the normal functions of this joint. So there is improper function of the dislocated joint. There is Sandhi Vikriya, improper function of dislocated joint. Now Vivartita, there is a dislocation with the lateral displacement. Sandhi Parshvabha Gamanat. So the Sandhi, the joints have, the bonds have moved away. There is a displacement. Vishama Angada, uneven of the joint, as well as Vedana or pain. What about Avakshipta? That is a with downward displacement. Sandhi Vislesha, so there is a drooping down of the joint. And Tivra Rucha, extreme or excruciating pain. Adikshipta, dislocation with overriding. Both bonds making up the joint would move apart, such as a gap is created between these two bonds, and the dislocated bond is removed away from the joint, and which become extremely painful. Tiryakshipta. There is a dislocation with the oblique displacement here. Any one bond forming the joint along get displaced to a side, and there is an accompanied by a sort of intolerable pain. Kanda Bhagna. Kanda Bhagna, there are 12 types. Again, Ashwakarna's Kaka cat, picked asti, Majja, Kanda, walk at patting chin softly. So Ashwakarna, so that is the first type of the Kanda Bhagna. Then Kaka, Karkadaga, cat, Churnida, picked, Pichida, Asti Chalita, Kanda Bhagna, Majjanugada, and walk means Vakra. At Adipatitha, patting, Padida, Chinna chin, Swudida softly. So try to remember this. Ashwakarna's Kaka cat picked asti, Kanda, Majja, walk at patting, chin softly. And Kanda Bhagna Lakshanam, Shvayadu Bahulyam. That means excessive swelling. Spandanam, there is a throbbing or pulsation. Vivartana, rotation, that is an abnormality in the position. Sparsha asahishnutvam. So can't bear at least the least touch the patient cannot bear. It is extremely painful. Avapedyamhane Shabda. There is some crepitus or some type of sound under pressure. Strasta Angada. Looseness or drooping of the limb, Vivida Vedana Pradhurbhava, presence of a variety of pain, Sarvasva Avastasu Na Sharmalabha. So there is no finding of comfort or relief in any position. Now Vishesha Lekshan of Kanda Bhagna, Karkadaga. Some Muda Mubhayado Asti. So the two broken ends of the bond have moved apart. And Madhye Bhagna. Grandhi Riva Unnadam. So Madhya Bhagna, that is the middle of the Bhagna, is Unnada like a Grandhi. So there is a bulging out of the middle part like a knot or tumor or Grandhi. Ashwakarna. Ashwakarnavat Udgadam Ashwakarnakam. That means there is the end of the bond project upward like the ear of a horse. Churnida. Sprishyamanam Shabdava Churnidam Avagachit. So when you know all these names, from the name itself, we can decode all the Lakshana. So Churnam, Shabdava Churnidam Ivagachit. So when we touch, we can hear a sound like a broken into pieces. Okay, that is produce sound as the broken into pieces when felt by the hand. Sprishyamanam. Pichida. Pichidam pradudam gadam analpa shobam. Again, the bond become thick or pradu, and there is profound shobam. Analpa shobam, not alpam, analpa shobam. That means more or profound swelling is there at the site of fracture. Asti chalita. Again, parshvayor asti hinodgada asti chalita. One part of the bond has dropped below. Other part is raised above. So, Parshvayor asti hina udgadam. So, one is dropped, other is raised. This is the asti chalita. So, asti has moved and one is above and one is below. Kanda Bhagna. Velathe prakampamanam Kanda Bhagnam. Fractured bond has tremors or trembles. There is a prakampanam when shaken. Majjanugada. Asti avayavo asti madhyamanu pravishya majjanamunna hyadadi majjanukadam. Majjana hyadi iti majjanukadam. So a part of the piece of the bone or middle portion of the bone get or pierce into the bone marrow. So the broken part has pierced into the majja. Majjana hyadi. And displaces the bone marrow. So it is piercing into the majja as well as the displacing the majja. We call it as majjanukada. Adipadita. Asti nisheshada chinnam adipadidam. So the entire bone is broken to pieces. Nisheshadi, every part, without any part is remaining intact. So the whole asti has broken. It is called the adipadita. Vakra. Abhugnam avimukta asti vakra. Bond is bent like a vakra. Abhugnam. So what is it? Bent like a bent inwards like an arch. Abhugnam vakra. Or has become curved without getting detached. Chinnam. Anyatara parshva avashishtam chinnam. Fracture in which the continuity of the bond is breached or severed at one side. So there is a continuity broken at one side. Other side is intact, but the one side the continuity is broken is called the chinnam. So only one part is broken, that is a chinnam. Anyatara parshva avashishtam. So one part is broken, other is intact. Padita. Sorry, not padita, padita. Padidam anu bahuvidharidam vedana vacha. Bond is cracked at multiple sides. So padidam means the bond is cracked at multiple sides and there is severe pain. Padidam anu bahuvidharidam vedanacha. So it is broken at multiple sides. There is asakya pain. Sfudida. Shuga purnamiva Vivadhumadham Vibhulam Visfudikritam Svudidam ithi. One is largely cracked and more swollen. And it is feel like Shuga Purnamima Avadhumadham. Shuga Purnamiva Dhumadham means it is filled like if the bond is feels like the bond is filled with shugam or thorn. Okay, so that is Sfudida. There is a Visfudikritam as well as swollen, that is a swelling, and there is Shuga Purna Iva Dhomadham. And now again Sadhya Asadhyada. There is Krichra Sadhya, Kanda Bhagna Sar, Churnida, Chinna, Adipadida, Majjanu Khada. These four are Kanda Bhagna, Krichra Sadhya. Also Bala, Vriddha, Krisha. Those occurring Bala, child, Vriddha, Krisha. That is also Krichra Sadhya. Also one suffering from asthma, Kushta, Kshadakshena, Sandhi Upagada. That is the fracture occurring near bony joint is also Krichra Sadhya. Asadhya, fracture of Kabhala, skull, Kadi, pelvic bone. Sandhi Muktam, there is a dislocation of the pelvic joint dislocation. Sandhi Chudam, when there is the subluxation. Jaganam Pradibishtam, crash fracture of hip bone. So, there is a fracture, Kabhala Kadi and Sandhi Muktam. There is a dislocation of the pelvic joint as well as the subluxation. Also, Pradipishta Jaganam, crash fracture of the hip bone or are Asadhya. And also asamslishtam kabhalam, separation of the skull suture, lalade churnidam. There is a churnida bhagna of lalada or forehead. Then that is also asadhya. And the sanandare, fracture occurring between the breast, fracture in the shanga, temple, prishta, back, murdani head. All these are asadhya. If the fracture and dislocation are formed in bonds or joints which are not formed properly from the beginning, or that is since birth. So some bonds may be formed not properly since birth. And if there is a fracture or dislocation, we have to varjya. That is, we have to avoid that type of fracture dislocation because it cannot be cured. Also in bonds or joint which are formed properly but currently not performing their function properly because of improper placement or bandaging or due to vigorous movement, that also avoided. That is bonds or joint. They are normally formed, but maybe due to some treatment, they are not functioning properly. Maybe due to improper reduction or bandaging, or there is vigorous movement. Due to that, it is not performing their function properly and had some fracture or dislocation on that part. We cannot treat them. So we have to avoid that type of fracture and dislocation. And the main thing is, among the three stages of life, person will be strong and stable in middle age or Madhya Vaya. So the most suitable age is Madhya Vaya. So we already saw it is Krichra Sadhya in Bala and Vriddha. So in Madhya Vaya is the best for the treatment. So the treatment of the fracture and dislocation should be undertaken after considering that is the person is strong and stable in the Madhya Vaya. So it will be easy to treat only during the Madhya Vaya. And other two conditions, that is the Bala and Vriddha, it is Krichra Sadhya. Taruna astini namyante, bhajyante nalagani tu, kabalani vibhadyante, swudandi rujagani cha. So due to aghata or assault, the tarunasti, what happened to tarunasti? The cartilaginous bond bent, namyante, nalagasti, tubular bonds break, that is bhajyante. Kabalani, flat bonds get fissured. And what happened to rujagasti, swudandi, small bond gets cracked. So tarunasti, namyante, nalagani, break, bhajyante, kabalani, fissured, vibhidyante, and rujagani, swudandi, get cracked. Thank you for watching my video. So for more details, I will be posting the more explained version of the Kanda Bhagna. You can also view that. Thank you for watching my video. For more updates, please like, share, subscribe. Thank you.